Thank you, Senator Scarr. It being right on 2 p.m, I'll call Senator Walsh.
Thank you, President. My question is to the Minister for Aged Care and Senior Australians, Senator Colbeck. Yesterday, the Minister said, and I quote, "We are in a relatively good position." What percentage of all COVID-19 deaths in Australia relate to people in residential aged care?
Minister for Aged Care and Senior Australians, Senator Colbeck.
Thank you, Mr President. The proportion of deaths in aged care as a proportion of the total deaths sits at about 70% in Australia. At about 70%. That's not the exact number, but it's about 70%. And, Mr President, if you compare that, and that's about 0.17% of the aged care beds in Australia. And the reason that I made the relativity comment, and I answered in the question yesterday, was that in the UK that number is the relativity of the number of deaths in residential aged care compared to the population is 5.3%, which is over 30 times as bad as Australia. It's worse than Australia by a factor of over 30 times. Mr President, I don't say that to downplay any of the deaths that have occurred in Australia in residential aged care. And in fact, Mr President, the interjections are quite offensive. I'm not trying to do anything but to state some actual facts with respect to this. And the Labor Party might like to play politics with this. They might like to talk Australia's effort down. That's fine. That's fine, Mr President. But can I say the public health response in Australia—
Senator Watt,
Senator
Cormann, on a point of order. Senator Watt, remember my rule about counting to 10 after your name has been called. Senator Cormann.
Interjections are always disorderly, and I believe they're even more disorderly in the current environment where we are seeking to maintain a COVID-safe workplace.
Order. Order. When there's silence, I'll call Senator Wong. Senator Wong.
Well, we are on the point of order. I would respond to the Leader of the Government and the Senate by saying this is about the minister's accountability and his accountability for his incompetence in the portfolio, which has caused deaths.
Senator Wong, that's not an appropriate way to address a point of order. I don't believe it's unparliamentary. It was completely out of order to use a point of order for that. It is not up to me to rule which interjections are disorderly or not. They are always disorderly. Interjections are not a method of holding a minister accountable. Questions and answers are. I ask senators to respect that and hear the minister in silence. Senator Colbeck to continue.
Thank you, Mr President. And Senator Walsh asks about the comparability. In Australia, we've had outbreaks in 200 residential aged care facilities, unfortunately. Very unfortunately. That's 7.7% of the 2,706 residential aged care facilities in Australia. In the UK, of the 9,081 care homes, 56% have had an outbreak, Mr President.
Order. Senator Colbeck, time for the answer has expired. Order. Senator Walsh.
Thank you, President. Does the minister accept the evidence to the Aged Care Royal Commission that the percentage of deaths in Australia that relate to people in residential aged care, and I quote, makes Australia the country with one of the highest rates in the world of residential aged care deaths as a proportion of deaths from COVID-19? Yes or no?
Senator Colbeck.
Thank you, Mr President. What I don't do, Mr President, is accept it as a reasonable measure. It is a fact, as it was.
Order.
It was actually, and I'll take the interjection, Mr President. It was actually evidence given to the Royal Commission. It wasn't the Royal Commission saying
Order,
that.
Senator Watt.
And so, Mr President, as I said, as a proportion of the fatalities as a proportion of the aged care beds in Australia amounts to about 0.1%, 0.17% of the aged care beds in this country. In the UK, it's 5.3, which is over 30 times worse than Australia. And while every single death is a tragedy in this pandemic, and in 7 out of 8 states we don't have a case in residential aged care. And unfortunately in Victoria, where we have uncontrolled community spread, the virus has inevitably got into residential aged care. That is what happens.
Order, Senator Colbeck. Time for the answer has expired. Order, Senator Colbeck. Time for the answer has expired. Order on my left. It is one of your colleagues waiting. Senator Walsh, a final supplementary question.
A woman who sadly lost her father from COVID-19 at St Basil's described the moment she learnt her father had died as the worst call of my life. Yesterday the minister said we had been, and I quote again, in a very good position. Does the minister expect this woman and her grieving family to agree?
Senator Colbeck.
Mr President, and thanks Senator Walsh for the question. Actually, no, I don't, because this family has been tragically impacted by the deadly nature of COVID-19. And I give her and her family my heartfelt condolences. I've spoken to many of these families myself, Mr President. I've spent time talking to them on community meetings, but I've also spoken to a number of them individually when they've wanted to have a conversation about what's occurred. We've set up an investigation into what happened at St Basil's, I think appropriately, so that we can understand the epidemiology of that event. We can understand what happened with respect to the delays in the Commonwealth being notified of the event, what impact that delay in notification had. And so, Mr President, I understand perfectly that this family would be completely and utterly devastated by the loss of their loved one.
Order, Senator Colbeck. Senator McKenzie.
Thank you very much, Mr President. My question is to the Minister representing the Prime Minister, Senator Cormann. Border travel restrictions imposed by state and territory governments have negatively impacted the lives and livelihoods of hundreds of thousands of regional Australians who live and work in and across border communities. Can the minister please outline what steps the National Cabinet is taking to secure a national approach from state and territory governments to issues of quarantine, essential movement across borders and the identification of hotspots to ensure that regional and rural Australians' access to healthcare, education and employment is not limited unnecessarily?
Minister representing the Prime Minister, Senator Cormann.
Thank you very much, Mr President. I thank Senator McKenzie for that question. Mr President, the government is committed to keeping Australia as open as possible in a way that is COVID-safe. In the wake of this pandemic, we must always be focused on protecting both people's lives and people's livelihoods. We are working with state and territory governments to put in place practical, common-sense solutions to a whole series of problems that have arisen as a result of hard state border closures, which are affecting access to services and our economic recovery. For example, we need to ensure that relevant exemptions are in place and applied consistently and efficiently, so that disruptions to critical services for border residents are minimised as much as possible. National Cabinet has previously codified the freight protocol, ensuring freight can keep moving efficiently and safely during this pandemic. Last Friday, National Cabinet noted some recent changes by states and territories to make it easier for people to cross borders, subject to appropriate arrangements, to access essential services and activities. Since Monday, farmers and critical agricultural workers who reside outside the border zone in Victoria now have a new pathway to enter New South Wales and move outside the border bubble for work. For people living in the border zone, a permit can be obtained for travel within the border zone for the purpose of work if they cannot work from home and to obtain medical care or access to health supplies. Victorian residents can obtain a permit to enter New South Wales for the purpose of receiving non-emergency medical or hospital services with no permit required in emergency situations. On Friday, National Cabinet also asked the Australian Health Protection Principal Committee to develop a common understanding of a hotspot across jurisdictions and consider movement restrictions for affected residents in that context. This further work will provide people who are living in those areas, particularly in rural and regional border communities, with clear guidance on where and when they can access health and other services, or where restrictions may mean they have to find alternative arrangements.
Answer has expired. Senator McKenzie, a supplementary question.
Thank you. The Victorian Labor government has imposed strict restrictions on regions not impacted by COVID-19, and just announced that these may continue for a further 12 months, whilst failing to stop Melburnians heading out to the regions. Can the minister please advise what impact preemptive border restrictions may have on health and education access, employment and people in need of compassionate consideration?
Senator Cormann.
Thank you very much, Mr. President. We have seen widely reported examples of hardship for residents in rural and regional border communities. Such impacts should, of course, be minimised wherever possible, and they can be minimised in a way that is COVID-safe. Throughout this pandemic, when it comes to restrictions on people's freedoms, we have been guided by the medical advice. Decisions on border restrictions must continue to be informed by public health advice. Ultimately, these are matters for the states and territories. However, it is up to the states and territories to set out clearly the medical advice informing their decisions and to ensure that there is a genuine public health upside in return for the restrictions and costs imposed on individual Australians and on our communities, in particular rural and regional communities across Australia. There is no rulebook on how best to deal with this crisis, but it is critical that decisions are made on the basis of advice from the medical experts and not based on political considerations. Indeed, that is why the National Cabinet has asked the Australian Health Protection Principal Committee to develop a consistent approach to hotspot management and the needs of border residents.
Expired. Senator Watt. Senator Watt. Senator McKenzie, a final supplementary question.
Thank you, Mr. President. Border restrictions are severely impacting our agricultural industry and food supply chains due to creating significant workforce limitations. Can the minister please provide an update to the Senate on how the Liberal and Nationals government is taking steps to address these concerns?
Senator Cormann.
Thank you very much, Mr. President. I thank the Leader of the Nationals for that question. National Cabinet agreed on 21 August to the development of an agricultural workers' code which would set out nationally consistent measures to support the movement of workers critical to the agricultural sector across state borders. The code would help to support individuals and occupations that help ensure the continuity of the agricultural sector. Without these workers, agriculture in Australia comes to a halt, with all of the consequences of that, including for people in the city. Very important for all of us to remember. This includes not just on-farm workers, such as shearers, grain harvesters and fruit pickers, but also those who provide agricultural businesses with critical services such as vets and agricultural mechanics. Sheep still need shearing, crops still need harvesting, and animals still need to be attended to by vets. There have been recent encouraging changes to exemptions in Queensland, New South Wales and South Australia, but there is more work to be done with the New South Wales-Victorian border in particular.
Senator Keneally.
Thank you, Mr. President. My question is to the Minister for Aged Care and Senior Citizens, Senator Colbeck. Yesterday the minister said, and I quote, "We have been extremely fortunate." Does the minister really believe the 100 families who have lost loved ones in the last 7 days to accept that we have been extremely fortunate?
The Minister for Aged Care and Senior Australians.
Thank
Senator
you, Mr.
Colbeck.
President. I don't think that the families who have lost loved ones would be feeling anything other than grief, Mr. President, and I understand that. They've suffered tragic losses. All 342 of them now. They've all suffered a really tragic loss, and again, my condolences and the government's condolences to them. But, Mr. President, in a comparative sense, the Australian government's management of the COVID-19 outbreak has been relatively good. In fact, I would rather be here in Australia than I would be anywhere in the world right now. I would rather be in Australia than anywhere else in the world. And that is also reflected
Order.
in the figures that we have with respect to the numbers of contractions of the virus in our residential aged care system. While the Labor Party might like to hang on calculations that place Australia in a bad light, Australia,
on my left.
if you're looking at the aged care stats on an international basis, we are doing relatively well, and the government takes no pleasure in the fact that these families have suffered this tragic loss, because it is a tragic loss, and I don't expect any of those families, Mr. President, to feel anything but the loss that they've felt. It is if you look at our situation in a global sense, Mr President, the Australian circumstance in a global sense, and our management of COVID-19 compared to the rest of the world, I'd rather be here in Australia than I would be almost any other country in the world.
Senator Keneally, a supplementary question.
Thank you. The minister just said he would rather be in Australia than any other country in the world and that the government has done reasonably well. The day before this man died in St Basil's, a resident received a call telling them their father was comfortably sitting in his room, isolated from a major coronavirus outbreak gripping the facility, when in reality their father was gravely unwell at the Northern Hospital. Minister, why should this man and his grieving family accept that the government has done reasonably well?
Senator Colbeck.
Mr President, thank you, Mr President. Thanks, Senator Keneally, for the question. It is disappointing that the opposition seeks to reinterpret what I'm saying in one context and apply it to another context. I have done nothing, Mr President.
Order.
I have done nothing but express my sympathies and the government's
Senators
sympathies.
on my left. Order. Senator Colbeck, please resume your seat. Order on my left. If I can't hear the minister, I won't be able to deal with inevitable points of order. Senator Colbeck.
Thank you, Mr President. Thank you, Mr President. It is disappointing that the opposition tries to take my comments out of context and apply them in a different circumstance, because that's not what I've said on any occasion. I have done nothing but express my sympathies for every family who's suffered a loss, because they are all suffering a family tragedy. And so I take offence at the fact that Senator Keneally tries to use my words in a way that I have never uttered them. It is in fact quite outrageous.
Order,
that she
Senator
seeks to do that.
Colbeck. Time for the answer has expired. Order. Order. Senator Faruqi. You're next, I think. I've got Senator Keneally for a final supplementary question.
A diabetic 75-year-old woman with COVID-19 was forced to go without breakfast, was left for hours in a urine-soaked bed due to a lack of staff. Does the minister really believe that the government has done reasonably well in addressing this aged care crisis and the COVID-19 outbreak in residential aged care homes?
Senator Colbeck.
Thank you, Mr President. And again, Senator Keneally deliberately misquotes and verbals me with respect to the words I've used and the context within which I've used them. And Mr President, I and the government have acknowledged that in some circumstances, but particularly at St Basil's, where we had 24 hours to restaff the entire facility, including management, that things didn't go as we thought they should have done.
Order.
That things didn't go
Order.
as we thought they should have done. And we've acknowledged it and we've apologised for it, Mr President. So, Mr President, so the families of these residents have
Order,
suffered.
Senator
The families have suffered an absolute tragedy, Mr President. But I will not take Senator Keneally misusing what I've said and placing it completely out of context, because it's completely unreasonable.
Order, Senator Colbeck. Senator Faruqi.
Thank you, Mr President. My question is to the Minister representing the Minister for Education. Minister, at least 16 members of the government, including the Prime Minister, went to uni while it was free. But your latest cruel, hypocritical plan will hurt students by hiking fees and cuts up to $900 million from teaching funding, including from STEM and nursing. The experts agree it's an unfixable mess. It won't create enough new places. It punishes struggling students. Your own department admitted it won't change student choices, and it incentivizes unis to enroll students in high-fee courses instead of STEM. The whole thing relies on useless job market predictions and bad data to punish students without saving uni jobs or fixing the research crisis. Youth wage growth is the flattest in history, and unemployment is skyrocketing. How can you justify condemning students to decades of debt?
Minister representing the Minister for Education, Senator Birmingham.
Thanks, Mr President. I thank Senator Faruqi for her question, much of which I disagree with the information that she presents as fact in that question. But I do think there are a couple of granules within all of that, that there are too many graduates coming out of universities at present who are not necessarily securing a job, a well-paying job, a job particularly in the field of their studies. And our reforms that we are presenting in relation to higher education seek to address some of those problems, to ensure that the way in which students are encouraged into university and supported through university does result in the optimal chances of them securing a job and indeed a job in the field of their training, study and ideally desires. Contrary to what Senator Faruqi says, there are no cuts in terms of Commonwealth funding or support. Indeed, funding for the Commonwealth Grants Scheme will continue to increase by CPI, and overall university funding will increase from $18 billion in 2020 to $19 billion by 2022. That will be some 10% growth relative to the 2018 position. Ms Tehan published the draft legislation of our Job Ready Graduates Package for consultation and indeed has now worked through that consultation phase and has presented a plan that will create more places for more students to attend university, an additional 39,000 places by 2023, an additional 100,000 places by 2030. No existing student is going to see changes in relation to their fees, but universities will see their record funding continuing to grow whilst we create the right incentives to encourage students to study in areas that optimise the chances of them securing a job and meeting our economic needs of the future.
Faruqi, a supplementary question.
Minister, you're actually forcing universities to enrol more students, thousands more, while cutting funding, and that is true for their education by an average of 15%. This means fewer teachers and bigger classes, a poorer quality of education across the board, and particularly in regional unis where the cost of delivery is higher. Minister, will you acknowledge that your plan is going to hurt the quality of uni education? And if you were still Education Minister, would you have brought forward this cruel plan?
Senator Birmingham.
Well, Mr. President, I do congratulate Minister Tehan on the reforms that he's proposing. Reforms that will see, for example, students who choose to study teaching, nursing, clinical psychology, English or languages paying some 40% less for their degrees in terms of the contribution that they make. I would have thought Senator Faruqi might welcome that. I would have thought there might be some acknowledgement of that. Students who study architecture or maths will pay around 60% less in terms of the student contribution for their degree. Students who study science, health, architecture, environmental science, Senator Faruqi, IT or engineering will pay around 20% less in terms of contribution for their degree. This is about making sure that we equip Australia and young Australians for the future with skills that will help them to get a job and our economy to grow and recover in the post-COVID era.
Senator Faruqi, a final supplementary question.
Minister, your government has stood by while thousands of university workers have lost their jobs. The likes of Crown Casino have received more than $100 million in JobKeeper, but you have changed the rules 3 times to maliciously lock universities out. Now you're intent on cutting funding, hiking fees and punishing struggling students. Minister, what do you have against universities?
Senator Birmingham.
Mr. President, this is a quintessential problem that exists with the Australian Greens. You can say whatever you want in terms of outlining the facts, and they are just completely ignored. I outlined the growth in funding. I outlined it might be a shared problem with the Labor Party. That's why they're all on that side of the chamber, Senator Cormann. You outlined the fact that funding continues to grow right into the future, and Senator Faruqi still stands up and talks about cuts in funding to Australian universities. She tries to draw an analogy to private sector businesses who have seen their revenue collapse in terms of their business operations, whereas what the Australian government has done for universities is provide guaranteed ongoing funding to those universities during this COVID-19 crisis. So there's guaranteed funding that the Australian government continues to provide on behalf of taxpayers and students to universities. There's growing funding in the future,
Senator
and there are
Birmingham.
better
Time for the
incentives
answer
for
has
students.
expired. Senator Bragg.
Thank you, Mr President. My question is to the Minister representing the Minister for Health, Senator Cash. Can the Minister update the Senate on the Morrison government's COVID-19 vaccine strategy?
The Minister representing the Minister for Health, Senator Cash.
Thank you, Mr President, and I thank Senator Bragg for the question. Mr President, we know that the search for the vaccine is one upon which the world is focused. Without a vaccine, as we know, we won't be able to return fully to the life that we have known prior to COVID-19, and you only have to look at the changes that we've had to make here in the parliament as a result of the COVID-19 pandemic. The Australian government is taking targeted action to ensure that Australians have access to safe and effective COVID-19 vaccines if and when they become available. Mr President, our strategy is fourfold. The first is research. We've allocated over $358 million towards research in relation to vaccines, preventions, treatment and respiratory medicines. Most significantly, there's been an investment of $5 million in the University of Queensland molecular clamp. Another vaccine funding round is opened, and the government expects to receive the peer-reviewed recommendations shortly. The second is direct procurement with leading international vaccine candidates. We have already announced our agreement with AstraZeneca, and negotiations are advanced with multiple other candidates. The third is participation in the International COVAX facility, which is an international consortium to give participant nations access to a variety of potential vaccine candidates. It acts as a common platform for investment in return for common participation in whichever vaccine is successful. And the fourth is onshore manufacturing capacity for a vaccine in Australia, either directly or under a licence, including through CSL. Mr President, we're confident that these investments and actions will secure early and sufficient access to a safe and effective vaccine.
Senator Bragg, a supplementary question.
Thank you, Mr President. Can the Minister advise the Senate how the government's agreement with AstraZeneca will ensure Australia gets access to this important vaccine if it is successful?
Order on my left. Order. Order. I'm going. Order on my left. I'll call the senator to continue when there's quiet. Senator Bragg.
I'm going to read it again.
I've got most of it,
Sure.
Senator Bragg.
Can the Minister...
We're wasting time the opposition tends to find valuable. Senator Watt.
Can the Minister
Bragg.
advise the Senate how the government's agreement with AstraZeneca will ensure Australia gets access to this important vaccine if it is successful?
Order. Senator Cash.
Well, thank you, Mr President. As the Prime Minister and the Health Minister have stated last week, the government signed a letter of intent with the UK-based drug company AstraZeneca that would mean Australians get access to the University of Oxford COVID-19 vaccine for free should trials prove successful, safe and effective. The government and AstraZeneca are committed to working together so that all Australians will get access to such a vaccine. Of the 160 different vaccine projects in the world, the Oxford vaccine is one of the most advanced and promising. Crucially, the letter of intent between the government and AstraZeneca covers all of the steps that are needed to bring a new vaccine to market. It covers vaccine development, production and distribution.
Senator Watt.
Mr President, the government will continue discussions with many of these developers, while at the same time backing Australian researchers. We will continue to take advice from our best medical, scientific and manufacturing experts.
Senator Bragg, a final supplementary question.
Thank you, Mr President. Minister, as we await the development of a vaccine, why is it important to maintain social distancing and practical health steps to minimise the risk of transmitting the virus so we can reopen and grow a COVID-safe economy?
Senator Cash.
Well, Mr President, as the entire world watches and waits for a vaccine, it has never been more important to observe appropriate health precautions. And indeed, the second wave that the state of Victoria is now experiencing has made it abundantly clear in terms of how vigilant we need to be in observing practices like social distancing. In June and July of this year, we saw positive signs of economic recovery in the states that have suppressed the virus. As we minimise the transmission and the risk of transmission, we minimise the risk of harming the economy. Mr President, we must all exercise an abundance of caution and continue to follow the medical advice on the practical steps that will keep us all safe. And again, stay 1.5 metres away from other people whenever and wherever we can. Maintain good hand washing and coughing and sneezing hygiene. Stay at home if you're unwell and get tested if we have respiratory symptoms or a fever. And of course, download the COVID Safe app so that we can find
Senator
the virus
Cash.
more quickly.
Time for the answers expired. Senator Watt.
Thank you, Mr President. My question is also to the Minister for Aged Care and Senior Australians, Senator Colbeck. When did the minister first learn he had been cut out of decision-making in the aged care emergency response? Was the minister ever consulted on the decision to exclude him?
The Minister for Aged Care and Senior Australians, Senator Colbeck.
Thank you, Mr President. The reality is that there's been no change in the decision-making process with respect to the establishment of an aged care response centre in any state. Mr President, I think the interjection from behind me is correct. Don't always believe what you read in the newspaper, Mr President. The decisions around the establishment of an aged care response centre are made through the AHPPC. That is the decision-making process under the auspices of the National Cabinet. It's been discussed at National Cabinet now on 2 occasions, last Friday and a fortnight before. Mr President, the AHPPC has and does report to the Health Minister. So in that context, as an organisation that reports to the Health Minister in implementing our national COVID-19 health response, that's the decision-making line. So nothing has changed, Mr President. It's always as it was, but I and my department play an important operational role in the oversight of all of those facilities, as I do in Victoria.
Senator Watt, a supplementary question.
Thank you, Mr President. Has the minister been sidelined because he failed to produce a COVID-19 plan specifically for the aged care sector, or because he failed to learn the tragic lessons of Newmarch House, or because he forgot the number of deaths in residential aged care on Friday, or because he couldn't get the number of deaths right again yesterday? Or was it because of the first, second or the 328th tragic and avoidable death of an older Australian in aged care?
Senator Colbeck.
Thank you, Mr President. Mr President, I just completely reject the premise of the question. I completely reject the premise of the question, Mr President. Don't believe everything that you read in the paper. Don't believe everything that you read in the newspaper. I've just explained the process for the establishment of these centres. Mr President, I was consulted in the process for the formation of these centres across Australia before the documentation went to National Cabinet last week, so I was well aware of all of the processes last week before any decisions were made with respect to the formation of a recovery centre in any other state, because I played a part firstly in the formation of the Victorian Aged Care Response Centre and also in the process for the decision-making of those that might be required subsequently.
Senator Watt, a final supplementary question.
Thank you, Mr President. If the minister is being cut out of decision-making in his own portfolio, can he tell Australian taxpayers exactly what he is being paid for?
Senator Colbeck.
Thank you, Mr President. And Senator Watt demonstrates what happens when you just read the pre-written supplementary that you've been given before question time rather than listening to the answer that's just been given. Mr President, I've just explained the process that's been involved with the design of recovery and response centres for aged care in all of the states. I've explained my involvement in it and I've explained the process by which they're approved, and I stand by my answer.
Senator Rennick. Order.
My question is to the Minister for Trade, Tourism and Investment, Senator Birmingham. How is the Morrison government growing a COVID-safe economy by supporting Australian exporters and helping to keep Australians who rely on the exporting sector in jobs through the COVID-19 pandemic?
Minister for Trade, Tourism and Investment, Senator Birmingham.
Thanks, Mr President. I thank Senator Rennick for his question, a known champion of Australian business and Australian jobs, and particularly those from Queensland. Mr President, right across the globe, far too many businesses, far too many jobs have been tragically disrupted by COVID-19. Some of those disruptions, including here in Australia, have been unavoidable as a result of necessary shutdowns and restrictions across economies. Others have been consequential disruptions, and indeed, for many of our exporting businesses, they have been a victim of the consequences of different restrictions. Particularly for those exporting premium produce to the world, they have been victims of the shutdown of international aviation. An estimated 80, even 90% of international air freight out of Australia is traditionally carried in the bellies of passenger aircraft, which of course are no longer flying. That's why our government has injected more than $350 million into the International Freight Assistance Mechanism. It's targeted, it's temporary, and it's providing emergency support to make sure that exporters, while still having to pay a premium to get their goods to market, can at least still get it to market. Indeed, we've sent and supported Western Australian pork getting to Singapore, Tasmanian salmon to Taiwan, Cairns coral trout to Hong Kong, New South Wales tuna to Japan, South Australian kingfish to Europe and Victorian lamb to the UAE. IFAM is providing also important support for medical imports coming back into the country, critical, essential imports in our national interest. To date, IFAM has supported an estimated 4,376 flights that would otherwise probably not have occurred, from 9 domestic departure points to over 65 international destinations, carrying 94,500 tonnes, representing more than $1.1 billion in export value to our nation, ensuring those exports still flow
Time for the
and income and
has
jobs for Australia.
expired. Senator Rennick, a supplementary question.
Can the minister advise what feedback he has received from Australian business and Australian exporters about the International Freight Assistance Mechanism package?
Senator Birmingham.
Our farmers and our exporters work incredibly hard to secure export contracts around the globe, and the last thing we want to see is them lose that reputation for reliability and lose those contracts simply because they can't get their goods to market. And so businesses across the country, exporters across the country, have welcomed the work of IFAM. Indeed, in Senator Rennick's home state of Queensland, the Australian Reef Fish Trading Company in Cairns has said that without IFAM we would be in survival mode. But instead, in the last 2 months, they've put on 2 new people and increased their administration officer from part-time to full-time. The availability and reliability of flights has allowed them to commit to buying fish from the boats. That's kept them in business and their crews in jobs, with flow-on impact to fuel suppliers, mechanical workshops, bait and wholesalers. Indeed, Sunpork in Kingaroy says the IFAM initiative was an extremely useful stimulus when passenger transport came to an abrupt halt and our normal freight avenues were cut off, while Prime Fish from the Gold Coast acknowledges that because of IFAM we've been able to get produce to where it needs to go.
The answer has expired. Senator Rennick, a final supplementary question.
In comparison to other countries, can the minister update the Senate on how the Australian goods export sector is faring during the COVID-19 pandemic?
Senator Birmingham.
Mr President, like all aspects of the economy, there are impacts because of the disruptions, not just to air freight, but disruptions in a whole range of other ways. And in the first 6 months of this year, Australian goods exports have been down 3.7% on the same period in 2019. But they're still worth in excess of $183 billion. And if we compare that 3.7% decline for Australia with elsewhere around the world, we can see that preliminary OECD data shows an average goods export decline across OECD nations in excess of 15%. It's 3.7% decline for Australia, but more than 15% for the OECD on average. Across the G7, it's estimated to have been a decline in excess of 17%. In the US, a decline in excess of 16%, in Canada in excess of 18%, in Japan in excess of 14%. That demonstrates that Australia's exporters continue to navigate the complexities of this time, generating export income and jobs for Australians.
The answer has expired. Senator Lambie.
Thank you, Mr President. My question is to the Minister representing the Minister for Veterans Affairs, Minister Reynolds. On the 5th of February 2020, the Prime Minister announced that the Australian government would establish a new National Commissioner for Defence and Veteran Suicide Prevention to inquire into suicides of serving and former ADF members. Part of this announcement was the appointment of an interim commissioner to commence a review of known and current former defence personnel suicides dating back to 2001. My question to the minister is, who is the interim commissioner?
The Minister representing the Minister for Veterans Affairs, Senator Reynolds.
Well, thank you very much, Mr President, and I thank Senator Lambie for her question. I can confirm for Senator Lambie and the Senate that legislation will shortly be introduced by the Attorney-General to set up the office of the Commissioner, of the Permanent Commissioner. As I said, the Interim Commissioner will be appointed shortly to implement that work. So, Senator Lambie, would you like me to finish? Thank you. So what I can confirm is, once appointed by the Attorney-General, the National Commissioner will work to identify and undertake the factors and the systemic issues that may contribute to suicide risk amongst serving and former members. They will have all of the powers of a Royal Commissioner. The government has been acting on this, and as I said, the Attorney-General will be introducing legislation shortly to set up this position.
Senator Lambie, a supplementary question.
Thank you, Mr President. As part of the February 5th announcement, the Prime Minister, the Minister of Veterans Affairs and yourself all said that an interim commissioner would immediately commence a review of historical suicides and report within 12 months. Did that review commence immediately as promised?
Senator Reynolds.
Thank you very much, Mr President. As I've said, we've got the legislation underway for the Permanent Commissioner and to set that up this week. As part of that process, we will still be appointing an interim commissioner, and the Attorney-General is in the process at the moment of going through a shortlist for the interim commissioner to undertake the work as discussed.
Senator Lambie, a final supplementary question.
Thank you, Mr President. If you say something is ready to go immediately, your words, not mine, how can it possibly be delayed? It's either ready to go or it isn't. Was it ready to go in February, and if not, why did you claim it was?
Senator Reynolds.
Well, thank you very much, Mr President. As I announced in February, we did say that we would bring forward this office of the Commissioner that would have the powers of the Royal Commission, and we would establish an interim commissioner, which, as I've said, the Attorney-General currently has a short list of applicants for that process, for that interim process. But I would also note that we did say that we would appoint a family veterans advocate, and in fact we have done so with an outstanding person who has been appointed by the Governor-General, Ms Gwen Churn, as a veterans family advocate. So we have actually implemented that, and we will shortly be announcing the interim commissioner. So we are delivering on exactly what we promised to deliver. We've got the legislation in train, we've got in train the appointment of the interim commissioner, and we have appointed an outstanding family veteran advocate. So this government is delivering exactly what we said we would do, Senator Lambie.
Senator Gallagher.
Thank you, Mr President. My question is to the Minister for Aged Care and Senior Australians, Senator Colbeck. Minister, when asked on Friday whether you'd brief the Cabinet between the 10th of July and the 5th of August, the Minister said, and I quote, "I don't believe that I attended a Cabinet meeting in that period. I'll check the record for you." Given the Minister has had 4 days to check the record, did he brief the Cabinet on the growing crisis in aged care in that period?
The Minister for Aged Care and Senior Australians, Senator Colbeck.
Thank you, Mr President, and I thank Senator Gallagher for the question. I didn't brief the Cabinet in that period of time, but Mr President, I have been participating on a daily call with the Prime Minister, senior colleagues, the Health Minister, and so effectively a subcommittee of the Cabinet every day, all through particularly the Victorian circumstance, and sometimes twice a day. So, Mr President, this is not what, as the Labor Party might try and play it, some sort of frivolous process. We have been working very closely on a daily basis to address the circumstance, particularly in Victoria. And so I've been working with the PM, with the Finance Minister, Senator Ruston, the Treasurer, the Health Minister, and a number of other colleagues and senior departmental officials across agencies every day to bring the resources to bear that we require to manage what was a growing outbreak in Victoria, and we needed to inject significant resources to assist both the Victorian government and the aged care sector in Victoria to deal with what was a growing situation. And we continue to do that. We continue to meet on a regular basis. And I have a separate meeting every day with the Victorian Aged Care Recovery Centre to get a situation update on the circumstance that's going on in Victoria, in particular, given the continuing situation that is there. So the government is not, as is attempted to be portrayed by the opposition, doing anything other than putting its full attention to this at the highest levels on
Order,
a daily,
Senator Colbeck.
sometimes
Time
twice
for the
daily
answer
basis.
has expired. Senator Gallagher, a supplementary question.
Thank you, Mr President. As Minister for Aged Care in this government, when did you first brief the Cabinet about the outbreak in residential aged care in Victoria?
Senator Colbeck.
Mr President, I have spoken to the Prime Minister and senior Cabinet colleagues on a daily basis with
Order. Senator Gallagher, on a point of order.
Order, direct relevance. It was a direct question about when he first briefed the Cabinet, not when he had a chat with the Prime Minister. That's not the question we asked.
Senator Cormann.
Very much, Mr President. Senator Colbeck is directly relevant to the question asked. He's explaining that he has had daily conversations with the leader of the Cabinet, and indeed with all of the ministers that are part of the key Cabinet subcommittee, the Expenditure Review Committee and others as appropriate. And that is, in a moment of crisis, that is of course what Australians would expect their Minister for Aged Care to do, and the ministers being directly relevant to the question.
Senator Wong, I'll take Senator Wong on the point of order and then I'll rule.
Thank you, Mr President. The the point of order is direct relevance. The minister has been asked and answered a question about the Cabinet briefing. He's now seeking to avoid answering another question about Cabinet briefing in relation to an unprecedented crisis in aged care which has caused the deaths of many Australians. We would ask the minister to be directly relevant to the question, which is when did he first brief the Cabinet about this unprecedented crisis?
First, I will say the minister has been speaking for 8 seconds, so it is difficult to make a strict judgment on direct relevance at that point in a 1-minute answer. Secondly, I'm not willing to rule that a minister who is strictly talking about his conversations or discussions with the Prime Minister is not directly relevant to a question regarding whether he briefed the Cabinet, given that the Prime Minister is the head of Cabinet. However, the answer must be narrow in its scope to that. It is not up to me to instruct a minister how to. It's not up to me how to instruct a minister how to answer a question. It is up to others to judge or debate after question time. Senator Colbeck to continue. Thank
you, Mr President. As I have said, I am not going to allow the Labor Party to try and attempt any suggestion that this government has not been putting its full focus on the management of this entire COVID-19 outbreak, and I have been present at the subcommittee of Cabinet meetings since March to discuss on each of the occasions that it has convened, and since July it would be daily or sometimes twice daily to manage the circumstance in Victoria. The outbreak in Victoria has had the full attention of me, my fellow ministers that are involved in that subcommittee of Cabinet and the Prime Minister on a daily basis.
Order, Senator Colbeck. Time for the answer has expired. Senator Gallagher, a final
So I
supplementary
presume the
question.
answer to that question was you never ever have. Minister, in light of the unprecedented crisis in residential aged care in Victoria, with the loss, sadly, of more than 328 lives, how can you possibly justify not briefing the federal Cabinet about this unprecedented crisis in aged care?
Senator Colbeck.
Mr President, the Labor Party tries to make this something that it's not. And as I've said, I am focusing on my job with the ERC, with the Prime Minister on a daily basis, with the Finance Minister, with the Treasurer, with the Minister for Social Security and anyone else who is seconded to the committee, with the Minister for Health on a daily basis. Any suggestion that the Labor Party tries to make that this pandemic has not received my full attention, the Prime Minister's full attention and the government's full attention is just not so, Mr President. We have been there every single day to make sure that the resources that need to be brought to bear can be brought to bear and are brought to bear.
Senator Chandler.
Thank you, Mr President. My question is to the Minister for Families and Social Services, Senator Ruston. How is the Morrison government ensuring people with disability and their carers have access to appropriate and accessible information during the coronavirus pandemic?
The Minister for Families and Social Services, Senator Ruston.
Thank you very much, Mr President, and thank Senator Chandler for this really important question. Clearly, the coronavirus is going to impact disproportionately on certain groups in our community. These groups are more likely to be at risk of contracting the virus and more likely to have poorer health outcomes, and none more so than many of our people who live with disability. So making sure that people with disability, their families and their carers can access information about such things as preventative measures, good hygiene and where to get the appropriate supports that they might need to get them through the pandemic have never been more important. And that's why the government has provided additional funding for a disability information hotline specifically directed in providing advice around the COVID-19 pandemic. This free 1800 number is available 8 a.m. till 8 p.m. Monday to Friday, and it provides information, it provides referrals, it provides support and emotional support and counselling to people who are impacted by either living with disability or supporting somebody who does live with disability. We've made sure that our staff are highly trained so that they can understand what the person needs and making sure that they can provide them with the information and the support that they may need, and making sure that they're directing them to things such as knowing where to get PPE, knowing if they need food relief, where to get that, and just making sure that there's a friendly voice on the end of the phone if these people want someone to talk to. Since April, we're delighted to say that a number of people living with disability, their carers and supporters, have used the services of the hotline. Over 2,700 calls have been received, many of them are telephone-based but also online. And more than 1,700 of these calls have been able to be referred to appropriate services to support these people in the particular areas that they need. And we wanted to make sure that through this process that people who live with disability were able to get the flexibility and choice around the services they needed.
Senator Ruston. Senator Chandler, a supplementary question.
Thank you, Mr President, and I thank the Minister for her response. What is the government doing, Minister, to support the mental health and wellbeing of people, including people with disability and their carers, in response to COVID-19?
Senator Ruston.
Thank you very much, Mr President. The government absolutely recognises the significant effect that this COVID pandemic is having on the mental health of all Australians. And people who live with disability are also significantly impacted by this, whether it be through isolation, meaning that they're cut away from or kept away from people that might be supporting them or their loved ones, whether it be social distancing or a number of other restrictions that are placed on Australians. That's why we have provided additional support to all Australians, but particularly in recent times an additional $12 million has been made available to make sure that people in Victoria have access 24 hours a day, 7 days a week to health services. This might be things like Lifeline, it might be Headspace, it might be Kids Helpline, because we want to make sure that the services so that people can seek support and get the counselling they need. This is part of a $500 million mental health package that's been put in place by this government to support mental health during this pandemic.
Senator Chandler, a final supplementary question.
Thank you, Mr President. Minister, into the future, how will the government ensure best practice support for people with disability who have experienced complex trauma?
Senator Ruston.
Thank you very much, Mr President. Well, clearly positive
positive experiences with support workers and carers and advocates for people with disability is absolutely critical in reducing or minimising harm and trauma, and it helps to foster a trauma-informed recovery and healing process. We, as the government, are funding a development of a best practice guide to make sure support for people with disability is appropriately targeted to their experiences, to make sure that it is trauma-informed. The government is providing funding to Blue Knot, a well-known supporter of counselling services, to develop this guide. Blue Knot actually has already developed guides, similar types of guides. In fact, they published the Practical Guide for Clinical Treatment of Complex Trauma. The guide will help to build better capacity of organisations and practitioners to help them better understand complex trauma and make sure that the response, particularly to people with disability, is informed by that information. This work formed
Order.
part of—
Senator Ruston, time for the answers expired. Senator Waters online.
Thank you very much, President. My question is to the Minister representing the Prime Minister, Senator Cormann. In response to allegations aired earlier this year about branch stacking and misuse of public funds by members of the Victorian Labor Party, the Prime Minister said the issue raised many questions the Leader of the Opposition had to answer. And yet, when allegations of branch stacking and misuse of taxpayer funds by Assistant Treasurer Mr Sukkar and a senior federal Liberal member were aired this week, the Prime Minister said it was an issue for the Victorian Liberal Party and not his responsibility. Why the double standard on integrity?
The Minister representing the Prime Minister, Senator Cormann.
Thank you very much, Mr President. I can confirm that the matters that were raised earlier this week indeed are appropriately a matter for the Victorian Liberal Party organisation, which I understand has taken appropriate steps in relation to an individual that, unlike what was the case with the alternative proposal. It's interesting to see how the Greens are in here pitching for the Labor Party. The Greens are in here pitching for the Labor Party. That's interesting to see. But of course, the relevant individuals concerned, as I best remember it, I'm not really all that focused on internal party matters like this. I'm focused on the job that the Australian people want us to do, which is to protect people's health and to protect people's livelihoods through this pandemic. That's what we're focused on. But I can confirm for the good senator that the issues that were raised in relation to internal party matters are indeed matters for the Liberal Party organisation. To the extent that there were issues raised about the alleged misuse of taxpayer-funded parliamentary resources, well, these are matters that both the relevant federal members concerned have referred for independent inquiry by the Department of Finance, which is the usual process, which is applied indiscriminately on an entirely non-partisan basis whenever these issues arise, as I'm sure members and senators from all around this and the other chamber would be well aware.
Senator Waters, a supplementary question.
Thanks, President. Scandal after scandal in this term of government has shown that the Prime Minister is reluctant to enforce his own prime ministerial standards, to lift those standards of behaviour. Will the Prime Minister investigate whether Assistant Treasurer Mr Sukkar's actions have breached the ministerial standards, and will he stand Mr Sukkar down while doing so?
Senator Cormann.
Thank you very much, Mr President. No attempt at the Greens trialling their code for a future coalition with the Labor Party, where no doubt they'll come out and try and harm the economy and jobs again, will distract us from our job, which is to support Australians, to protect people's health, to protect people's livelihood through this pandemic, and to ensure that we put in place the plan for the strongest possible economic and jobs recovery on the other side. That is what we are focused on. You can
order. Sorry, I was reading something. The clerk passed me. Apologies, Senator McKim. On a point of order.
Thank you, President. The point of order is relevance. We're now two-thirds of the way through the minister's time provided to answer this question. The question was very clear. It was about prime ministerial standards and whether Mr Sukkar would be stood down while the Prime Minister made that assessment. Minister Cormann has gone nowhere near the question in his answer, and I ask you remind him of the question.
Senator McKim, you reminded the minister of the second part of the question. It did have a preamble. The minister is allowed some discretion in being directly relevant to the preamble as well, but I'll let you remind him of the point of the question. Senator Cormann.
Thank you very much, Mr President. It is clearly a partisan political question in relation to party organisational matters. It's interesting that in the middle of a pandemic, a senator for Queensland is interested in internal party matters in the state of Victoria. I mean, I let the people of Queensland judge that at the next election. No doubt that is why the vote for the Greens is particularly weak in that particular state.
Senator Waters, a final supplementary question.
Yes, thank you, President. Perhaps I'll get an answer to this one. A strong, independent integrity commission is essential if we're going to stamp out the ongoing scandals that beset this place. How much longer can the government delay?
I'm going to ask, because we're past 3 o'clock, we won't impact the time. I'll ask the Minister, Senator Waters to start again, because the volume in the chamber wasn't as loud as it could be. Senator Waters, could you speak up if you could, please?
Yes, thank you. Thank you, President. A strong, independent integrity commission is essential if we are to stamp out ongoing scandals in this place. How much longer can the government delay bringing on legislation for a federal corruption watchdog, whether that's my bill, which passed the chamber almost a year ago, or your own bill, which was described as imminent 18 months ago? What more does this government have to hide?
Senator Cormann.
Thank you very much, Mr. President. Australia has one of the proudest and best records in the world when it comes to providing open and transparent and accountable government. And I can see Senator McKim sneer at that, but that is a fact. And of course, we are committed to pursue further reforms in this regard to even further strengthen an already strong position. What I would say, I think the Australian people well understand why, over the last 6 months, we have prioritised our crisis response to protect people's lives, to suppress the spread of the virus, to slow down the spread of the virus, to ensure that our hospitals could handle the inflow of patients into the health system, to ensure that we provided the necessary supports to Australian businesses, Australian workers and those Australians who lost their jobs. I think Australians understand that there has been a pandemic going on and that clearly it was quite appropriate that in this context we prioritise the many measures that had to be taken as part of a crisis response. I thank the Senate and ask that further questions be placed on a notice paper.
Senator Faruqi.
Mr. President, pursuant